Hi, it's Tara. Today I want to talk about prescription medications for depression and anxiety. And I know I often have people think that because I'm so passionate about the holistic remedies and therapies to treat depression and anxiety that automatically means that I'm anti-pharmaceuticals. But I'm not, because I know that there are some people that have really suffered for a long time and their antidepressant, for example, has been their lifeline. It's allowed them to keep functioning. So I'm not wanting to take that away from them. What I'm saying is I really want people and the medical community, your doctors in particular, to become more informed of all of the research that's out there supporting other things that are outperforming the antidepressants and anti-anxiety meds that they're prescribing out. What I'm concerned about is all of the clients that come to my office and they are on multiple medications, not just one, but multiple medications, because they're not getting the relief that they need. If you're on something and you're not getting 80% symptom reduction in it, it's not the right drug. You need to find something that's going to work better. Often people are saying they only feel 30% better, which is better than nothing. But for the side effects, the risk of psychosis that drugs, especially Prozac, has, the way it's impacting the brain, the way they're now linking it to increased risk of things like dementia. These are really things to be concerned about, especially when there's so many alternatives. So what I would rather see is that doctors, instead of writing a prescription right away, especially if they're not psychiatrists, what I would prefer is that they give a prescription that says, look, this is what we know is equal or better in treating depression and anxiety. So I want you to try these things for 30, 60, 90 days would be optimal. If you don't feel any better, come back and we'll look at the pharmaceutical options to treat what you're suffering from. And in that prescription, it would be daily exercise, 30 minutes a day. They would send you to a naturopath or functional medical doctor that could really give you some targeted, quality, high-dose supplements, therapeutic doses that we know outperform these SSRIs and anti-anxiety meds when they're given properly. This isn't something that you should be self-medicating with or trying to find your way through the health food store to do on your own. There are people that are trained in this that are really good at being able to get you the right combination of supplements that can support your system in this way. In addition, there's a ton of research coming out of homeopathy and its ability to treat depression and anxiety as well. So I would look at all those things, and here's the big thing, and I know I'm a psychotherapist, but most of my clients don't have a doctor that says first thing, which it should be first, which is find a counselor that you can connect with and see somebody weekly for some support, and do this for 3 months and see if you don't feel better, because that's what I'm here for. The work that we do with the modality that I use is working with the neuroplasticity of your brain so that you can change your brain. We know that your brain can change. So if you're depressed and anxious now, it's not genetic, it's not fixed or hardwired into your brain. Your brain can change. And in session, I help it do that. That's the point. And so in 90 days, you could feel so much better and never need to go on another drug again. You wouldn't need to be facing a lifetime of drug reliance or having to keep switching or adding different pharmaceuticals. So why they're not recommending weekly counseling for everybody first thing, I'm not sure. But all of those things combined for 30, 60, 90 days, and then come back if you don't feel better to get a pharmaceutical, that's the approach I would like to use. And I would like to see doctors implementing more often. I also would like to offer some big warnings on things that I'm seeing with some of these prescriptions. Prozac, again, as I said, has a high risk of psychosis. We don't know kind of long-term effects necessarily. Lots of kids I'm seeing are kind of zombied out on it. In addition, I'm seeing that with Abilify, and that one has had clients come in and then they've developed these Parkinsonian tremors. And in one client, they didn't go away. Seroquel, I'm really kind of upset about because doctors are prescribing it for sleep. Well, sedation is a side effect of this drug, but it is a heavy-duty antipsychotic that should only ever be prescribed for people that are in active psychosis. It's been linked to liver cancer and other health concerns. I think it's being overprescribed, and people are not functioning well on it at all. Be concerned about those. Do your own research. Be an advocate for your health and well-being. Get some support. Look at alternatives for 30, 60, 90 days. Be uncomfortable for a little while longer, but get some support so we can work at increasing your resiliency, and this will change your life forever. This can increase your capacity to cope and manage stress and trauma and deal with depression and anxiety and all of those states way better naturally. That is the optimal goal, and even your doctor would agree. I'm not anti-medication. I'm cautious about it. It should be a very last resort after you've seen a string of professionals that have had good quality training in this area. So I encourage you to do some more research. Be bold in being your own advocate. And I hope you're well. Till next time.